Let's talk about superbugs. What are superbugs?
Right, basically, evolution occurs almost at the speed of light when you get to the microorganisms. So we evolve at a certain rate, the bugs evolve at a much faster rate than we do. When Alexander Fleming first discovered penicillin, it was an antibiotic that was able to kill certain bacteria. The bacteria obviously didn't like that in an evolutionary sense, and after a while started passing genetic material to each other to resist those antibiotics. And as time's gone on, more genetic material has been passed from one bug to another that now makes some bugs very, very, very highly resistant to the antibiotics we have available. And apparently, in the community of men who have sex with men, there is a huge problem with a form of gonorrhea that is very, very resistant to current levels of drug treatment.
Right. So in terms of the superbugs, my nephew, he's eating things off the floor. He's, you know, always got things in his mouth. You know, he's a proper little boy, okay? Yeah. Is there any chance of him getting a superbug?
I don't think so in that sense. There is a view that children do pick up dirt and everything else, but that also boosts their own immune system. So it's not a bad thing, actually. Right. So the odds of that happening in that context, I think, are very low.
Right.
So I'm not pro sterilising our children. Our children should play, get dirty, have all those normal things, because that probably boosts their immune system. So that's a positive thing.
Okay, so can a superbug live in my fridge?
Very good question. In theory, yes. Let me give you an example. Say chicken. Chicken is one of the areas where one has to be very careful because a lot of chickens are infected with a thing called E. coli. If they're not infected with that, they're infected with something called Campylobacter. Now, it's not impossible that those bugs might have the multiple resistance that we're talking about. So the most important thing for you is to make sure that you cook your chicken appropriately and you wash your hands appropriately after having dealt with raw chicken. If you decide that you want to preserve some of that chicken, then when you freeze it, it's got to be done in the right way and it's got to be reheated in the right way. Otherwise, if it's left lukewarm, the bugs multiply at a very great rate.
Right. And how serious is food poisoning in this day and age?
Yeah, it's actually huge.
Is it on the up, as they say?
It's really interesting because if you think about it, most people, if they get a takeaway and get the squirts afterwards, don't report it to anyone.
Well, so you don't, do you?
Exactly.
That's so true.
Yeah, so there's a lot of data that we just don't have. One of the huge concerns in England at the moment is the lack of environmental health officers, because councils have had cuts. So there aren't enough.
Should that be the responsibility of the council?
Well, yeah, it is. But the problem is that there's.
But should it be?
Well, the point is someone needs to inspect facilities.
Yeah.
Someone needs to put that slight fear in a facility that someone might come round and check whether their hygiene rating is.
I think I'd be more scared of you than a councillor from.
Yeah, well, you know, but this is an issue. So what we found is that some places clearly the levels of hygiene are shocking.
Right.
And there's feces and there's all sorts of things going into the food, or they're not separating the hot food from the cold food, or the meat is with the fish. All of those things that increase the risk. So I think in answer to your question, there's a lack of reporting. In America, they found something very interesting. Do you know the tool Yelp? Now, Yelp is a way of doing reviews.
Yeah.
Well, the Centers for Disease Control found that if they looked at Yelp, they got more data than otherwise, because people would say on Yelp, I hate that restaurant, I got the squits.
Or I thought it was a fantastic restaurant.
Absolutely.
So you get two extremes.
Yeah, so using the negative data, they were able to pinpoint where the problems were in those communities. So I think that those tools could be very useful.
Okay. So what are the telltale signs? If I go in for a meal in a restaurant, are you sort of factoring things in that you're seeing, so you can't actually enjoy the meal?
I know what you're saying. I think the first thing is, are they brave enough to put their hygiene rating up? So if they put their hygiene rating up and it's 5 out of 5, you can feel confident.
But that's a legal requirement, isn't it? Or is it not?
Some hide it away.
Do they?
So you wouldn't even know. So you could actually say, could I see your hygiene rating, if you wanted to go that far? The other thing, there is an app actually that allows you to check hygiene ratings of restaurants. So you can actually download the app and then you can use that to check the hygiene ratings.
So you'd only go for 5 out of 5 restaurants?
Absolutely. Okay. So that's the other thing. The other thing is if they've got an open kitchen, that's incredibly helpful because you can see directly them dealing with the food and everything. If they've got a closed kitchen, I'm not sure what the law is, but I believe you are allowed to visit a kitchen should you want to.
Right.
Now, there may be cases where you say, do you mind if I just have a quick look at the kitchens?
That seems like a really good tip to me.
Yeah.
I'll think about that in mind if I've got any doubts moving forward.